Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Each week we cover topics related to the pre-med journey to medical school and beyond, from the MCAT to completing your application and from starting medical school to choosing a specialty. Our podcast will provide essential information for anyone contemplating a career in medicine.
Hey everyone, thanks so much for joining me today. It's Dr. Marinelli. Today I'm joined by Dr. Weintrub, who is one of the newer advisors with Med School Coach, but he has had an awesome career in plastic surgery. And so I was hoping he could join us today and talk a little bit about plastic surgery, give some of you out there an idea of what plastic surgery entails, and if you're thinking about a career in plastics, what you could expect. Dr. Weintrub, thanks so much for joining me today.
Oh, it's a pleasure, Renee. I'm happy to be here and happy to talk about plastic surgery.
Great. And I love that. I mean, it's one thing that's always telling about a specialty is if you get somebody that's really willing to talk about it and is excited to talk about it. So thank you for that. Could you start by telling us a little bit about how you got interested in plastic surgery?
Well, I actually became interested while working in an emergency room. It turns out there was a lot of trauma where I was working, and I had the opportunity to do some minor reconstructions, nail bed injuries, external ear injuries, and the like, and and was able to actually see some of my results in with one of the local plastic surgeons. As it turned out, a lot of the results were pretty good. So it piqued my interest, and I went on from there.
And so that was in medical school as you were kind of going through your different rotations?
Yeah, I was in the emergency room. And, it was at those times, there was a fair amount of, shall we say, unsupervised care being given. That doesn't happen so much anymore, but there was a lot of independence. So at that point in my training, I was able to actually do a fair amount and saw some good results and was encouraged by the practicing plastic surgeon who was attending the emergency room.
And can you tell us about, you got interested in it, you applied, you got into plastics. Tell us a little bit about your path through plastic surgery, if you will.
Certainly. I trained in a time where the requirements were a little bit different, and plastic surgery was an independent fellowship, really, after training in general surgery. So the training pathway changed about 2015, and now there are two pathways to train in plastic surgery. The new pathway, the preferred pathway, and the one that's most common is the integrated pathway, a 6-year training program at one institution. Alternatively, folks can do what I did, which was to train in general surgery first, and then after completing general surgery, going on into a plastic surgery program of 3 years duration. So that would be 8 years of training. The integrated program is at least 6, sometimes 7. So I took the path of general surgery followed by plastic surgery, and then I was lucky enough to train in Houston at the Texas Medical Center in microsurgery and in head and neck cancer surgery. So there are a lot of stops along the way, but most plastic surgery surgeons train for at least 6 or 8 years.
And what did your scope of plastic surgery consist of? I mean, I think a lot of people see what's on TV and they think of cosmetic plastic surgery, which some, of course, do practice and some don't. So what was like the scope of your practice?
Well, as you mentioned, plastic surgery is a really large field encompassing a lot more than cosmetic surgery.
Right.
Reconstructive surgery is sort of the flip side. And that includes congenital defects of the skull, cleft lip and palate, prominent ears, reconstruction after tumor surgery for breast cancer or skin cancer. Wounds are another area that plastic surgeons are interested in. For example, motorcycle accidents where there's a fracture of the lower leg and there needs to be reconstruction of not only the bones but the soft tissues.
Sure.
And there are lots of other fields, including microsurgery, hand surgery, and the latest is facial transplant surgery.
Right.
Yeah, so it's a very broad field. Plastic surgeons operate everywhere in the human body,
Right.
from the top of your skull to the tip of your toes. So it's a very broad field with lots of kinds of surgery, and it's not just cosmetic. There's a whole host of reconstructive work to be done, and that's the area that I personally specialized in. I was more interested in the reconstructive work, and I worked at the Veterans Hospital. We occasionally did a cosmetic surgery, but most of our work was hand surgery and reconstructive plastic surgery.
Right. Wow. Very, I'm sure, interesting and kind of rewarding patient population, working with veterans and providing reconstructive services for them.
Absolutely. It's one of those things where there was a wide variety of kinds of surgeries that we performed. It was not an acute care facility, so we didn't have acutely injured soldiers, but we had veterans, some of whom were recently discharged from active duty, who had wounds and other sorts of problems that needed care. So, and we took care of a lot of recently discharged folks recently discharged from the active military.
Mm-hmm. And you mentioned microsurgery. What does that look like in the plastic surgery realm?
Well, microsurgery is done with using an operating microscope, lots of magnification and terrific illumination in order to better see the structures the surgeon's operating on. And it consists of operating on small blood vessels, both arteries and veins, and nerves. And there are a variety of surgeries that are performed using the operating microscope, including microvascular free flap transfer, where tissue with its accompanying artery and vein, and sometimes nerve is moved from one area of the body, completely detached, and then inset and hooked up in another part of the body with reestablishment of the micro blood supply.
Mm-hmm. Wow.
And it's performed often. It's done very reliably now, with greater than 98% success. Just a small percent or two of flaps that either require a return to the operating room or worst case scenario they fail. But it's these days in the hands of an experienced operator, very reliable surgery.
Okay. And just out of curiosity, I'm sure the field of plastic surgery probably has changed pretty drastically, since you began your interest as a medical student several years ago. It seems like one of those fields, to me, at least, that is, especially in the news and medical breakthroughs, is something that's, forever changing and really getting modified as more technologies are developed and really the capabilities are stretched and you're able to do more and more.
Oh, that's absolutely true. As technology advances, surgical advances follow, and plastic surgeons are generally at the forefront of using new technology, because the whole idea of plastic surgery is to do two things, really: to preserve form and function. So anything in the technological realm that allows a plastic surgeon to improve his or her results in terms of form and function, it generally is adopted.
Yeah, that's awesome. And it definitely makes the field very dynamic and something where you can continue to learn and use new techniques as they get developed.
Absolutely. The whole idea really is that of plastic surgery is to figure out one big problem, and that's the whole idea of scarring. So plastic surgeons are forever working on techniques to eliminate scars and to prevent scarring that's unattractive. So wound healing and scar are very are very important topics in plastic surgery and the source of a lot of innovation.
Sure. Yeah, absolutely. So, someone's listening to this and maybe they're in medical school or going to start medical school and they think that plastic surgery is a field, that they may consider. What recommendations would you have for them?
Well, I think that the most important thing is to try it, to get experience, to take clinical rotations where you're exposed to plastic surgery and all that entails, and to see if it's something that you could see as a career.
Mm-hmm.
A lot of folks are sort of misled by the media. It's a lot different in the trenches when you're working in plastic surgery than it's portrayed on TV.
Yeah.
So I think the most important thing is to try it, to literally take rotations either at your home medical school or clerkships at a nearby or further away facility to get as much exposure as you can, because each plastic surgery unit is different with different talents, different emphasis. So it's important to get a good idea of what you're getting into.
Mm-hmm.
Because it's a very broad field.
Right. And it's such a dynamic and interesting field, but it's also a pretty competitive specialty too. Can you talk, with your time as serving on the selection committee for a plastic surgery residency at Brown, can you talk a bit about the type of applicants that you guys were looking for residents?
Well, as you mentioned, Renee, it is super competitive and gets more competitive by the year. Mm-hmm. So that top students tend to apply, and those top students have excellent academic records in medical school. They have high to very high scores on step 1. Mm-hmm. And they have excellent recommendations from their home school, especially in surgery and surgical disciplines. Nowadays, often the residents have done research, and the best research, or the best candidates have done research in plastic surgery, whether it's published or not. If they've worked on significant projects with reputable people, that's very well received. Mm-hmm. And the last thing I would say about securing a plastic surgery residency is to pick an institution or two where you really think you have keen interest and where you have a shot at getting in, and do an away clerkship. Mm-hmm. Plastic surgery programs tend to be small, just a few residents a year. So everybody has to live together for 6 or 7 years. Right. So it's important that the folks who are the decision makers get to know you and to see if they would like to work with you as a trainee over that extended period of time. Mm-hmm. So I can't emphasize that enough. Doing clerkships at institutions that interest you is a very important aspect of trying to land a fellowship residency. Right. Yeah.
Right, absolutely. And, just kind of thinking about, my experience in plastics, which is definitely limited. I definitely didn't have a lot of experience, just pretty limited on my surgical rotation in medical school. I worked with a few plastic surgeons, and, it's one of those specialties that is not something that, commonly people are going to spend a month on. So kind of backing up a little bit, I know you mentioned recommending that people do rotations. How would they, for someone that's maybe interested and maybe a third-year medical student, or do you have any recommendations for them where maybe that's not part of their core clerkships and they don't want to wait till their 4th year, to figure out that, yeah, I should do research and I should do some away rotations? What should those people be doing?
Well, I would recommend that they talk to the plastic surgeons at their medical school, see if there are opportunities to shadow them either in the operating room and or the office, and to reach out to local plastic surgeons in private practice to see if opportunities might be available to see what they're working on. Mm-hmm. Because you're right, it would behoove the trainee, the student, to decide to have exposure early rather than later in the 4th year.
Right.
It's certainly the earlier the better.
Mm-hmm. Absolutely. Well, that's awesome. I mean, I think this is so great and hopefully very helpful for people that are listening, that are interested in it, just because, like I was saying, your exposure to certain specialties in medical school can be limited. And so, if this is something you're interested in, definitely try to get experience right away. And I think it's great to hear a little bit about, what some of the specialties have to offer that maybe we just don't know as medical students or pre-meds. Dr. Weintrub, any last thoughts or tips or reflections on your career or anything else you want to share with the listeners?
Well, I think a couple things. One is that plastic surgery is an incredibly broad and interesting field that's quite dynamic and ever-changing. So I don't think you'll ever get bored if you become a plastic surgeon.
Yeah.
And the other is that these days it's just super competitive to get in. And so the earlier you make your decision and the better your track record and your test scores, and do research. And those are the ingredients that are looked at these days in order to land a spot.
Mm-hmm. Yeah, absolutely. Well, to all the listeners out there, if anybody's interested in plastic surgery, Dr. Weintrub is available for advising. I know he'd love to spend some time with you on the phone to chat about it more and give you some more information, and also talk about your own competitiveness if it's a specialty that you're considering. Dr. Weintrub, thank you so much for joining us today.
Oh, thank you, Renee. It's been my pleasure.
All right. Take care, everyone.
Our mission is to inspire, encourage, and inform students as you journey through a rigorous and intricate process of achieving your dreams in medicine. Visit us at prospectivedoctor.com and medschoolcoach.com for more essential resources in your medical school journey and beyond.